Hey, thank you for joining us for this session where we've got myself and Dr. Surina Chibber. How are we doing, Surina?
Good, thanks. I was loving the intro music. I was having a little bop then, just like bopping along. Yeah, lovely. Thanks for having me.
No problem. And in this session, we're going to be sharing with you how you can access and kind of have a look at this new platform that My Locum Manager that's been working towards with various other partners, including EMIS, is going to be able to share with you and how we can help plan your workforce, various other things. And to be honest, I'm going to let Surina explain it because she's probably a lot better at it than I am. So go for it, Surina.
Thanks, Gandhi. Yeah, so I'm Surina. I'm a GP and I'm co-founder of MLM, otherwise known as My Locum Manager. And I'm here today to talk to you about a really kind of exciting initiative from NHS England, which is the Primary Care Pools Framework, which is all about kind of providing a digital way to allow flexible working across primary care. And my role in it happened kind of last year, which I'm going to share kind of our journey, with it, and give you a bit more detail. So let me crack on. Okay, so this is a screenshot of the framework initiative, really. So each area is entitled for up to 120k to set up flexible GP staff banks, and it's called the Primary Care Flexible Staff Pools Framework, and it's got a really cool strapline, which is making primary care a happier place to work. And I think all of us kind of in primary care and in the grind with COVID and everything could probably do with a little bit of happiness and kind of helping us find our way to easier ways of working. Now, the anticipated benefits of this framework are across the system. So to reduce pressure on locum spend, to improve management of increased primary care demand, and to access groups of knowledgeable GPs local to the area who can be shared to where they're needed. I'm not a fan of the word deployable because I'm a locum GP and I don't like the feeling that I'm being loaded into a gun and shot somewhere. So I always call it sharing. And also I like the fact that, you know, sharing means I've got choice in where I want to work and I've got autonomy and flexibility. Whereas deployable, I don't know, sounds a bit autocratic to me. The other anticipated benefits are for practices and PCNs, improve the health and well-being of staff, increase resilience across general practice, and also to help reduce the burden in accessing temporary staff, and ultimately to build better relationships with pool members, so GPs, nurses, and other healthcare professionals who want to work flexibly. And I mean, I think part of the initiative, I've had a good read of the framework paper, obviously being a digital supplier on it, which I'm going to come to. But it looks like a lot of the initiative behind it is based on the people plan to help keep GPs in the NHS by offering them a way to work flexibly and to have a lot more control in their working week and the way they design that working week and how they choose to use their clinical skills across their area. So I think hopefully it's got anticipated benefits for the long term for both the GPs and staff members on the kind of bank and those in the area that they're supporting. So I wanted to share a bit about my story and my connection to the framework. So the framework this framework that I've just described has 120k per area, and each area can use that in a number of different ways, which includes accessing a digital solution off of an approved supplier framework, where the suppliers have gone through lots of governance checks, lots of processes to be approved, and that solution can be brought into your area for you to, as GPs, to hop on board and to access sessions, and for PCNs and other services in the area to find a better way to connect to you guys. It also includes the funding is involved in supporting GPs in the form of peer support and networking, and I think designed to be quite a holistic solution. So where I come into all this is last year, we at My Locum Manager were invited to tender for this framework, and we did. And I think there were over 30 providers or 30 digital platforms that applied, something like that. And just a handful got on, and we, like, very gratefully and humbly are one of them. And we bring something very unique to this framework. And I just wanted to share a bit of our journey to it, and kind of what our kind of dreams are kind of going forward. So we started back in 2016, and we are a GP-led organisation, and we started very humbly as a very simple system to help GPs like me manage the connections that I had with local practices and manage my portfolio roles, but with a lot of community support. And that then grew, much to my surprise, if I'm honest, into a national community of GPs. And it grew and grew, and we evolved. We met partners very kind of, I'd say with serendipity along the way, who we ended up collaborating with, and that was CCGs, federations, all looking for something like that we were providing. And that meant that our product evolved. And about 4 years ago, I met with the clinical IT systems with this vision that I had, with my kind of, I thought as a GP, I called them clusters then, they're now called PCNs. But I felt that there were two streams of where workforce was going. One was through external providers, and one was through an internal system. And I felt like there needed to be some kind of internal system to allow access to workforce. And it ended up that we have collaborated, and we've created an amazing product, never done before in primary care. I'm really excited about it. And I'm really looking forward to take that forward. So what is our
Surina,
mission?
if I could just ask a question there. So we've had a question that's come through from Raza. You meant it was about an earlier point you mentioned about and I'll put it on the screen. So how do you define an area? As you said, it's allocated £120,000 per area. Can you just give us a rough idea what that is?
Yeah, so it's actually 120K per ICS, and each ICS, each integrated care system, it can be made up anything from, I think, 3 to sometimes 5 CCGs. So that's the definition of the area according to the framework.
Awesome, thank you. Carry on.
Okay, so our mission, right, our mission has been from the beginning a better connection across primary care. That started with me wanting a better connection with practices in my local area. I wanted also not just a better connection for work, but support, peer support, networking, community, those kinds of things. And I think now with the direction that we're going with our partners like EMIS is really kind of bringing that better connection together in a way that it's not been done before. So we now are at a place where we have a GP community across every CCG in England. About probably over 9,000 sessions are done through our platform every month. And when we last looked at it, over 3 million patients were seen by our community every year. And now we're kind of at the stage where we're collaborating. I say now we're at the stage, we've been collaborating for a number of years now to kind of launch with products with providers like EMIS to create something new for primary care off the back of our community and what we've been doing so far. I think one of the things that I wanted to share, because I've spoken to so many locum GPs, so many practices, so many focus groups over the years. And I think what we're about is actually so much more than the shift booking, because, you can access jobs anyway, really. You don't necessarily need a platform to do it. And it's not actually the accessing jobs that our community or locums value often, actually. It's all the other stuff. And I think where we kind of have had a real passion and real interest, and I think that gets me out of bed every morning, is like the community that we have, supporting them with education and credentials and helping them deliver really good quality care, bringing resilience not just to practices and primary care, but to those individual GPs that are working flexibly or locuming, working in portfolio careers, and sharing their clinical skills and time across their area to support the system. We've historically recruited a lot of partners and salary GPs back into primary care. With the way our model is, it's just been a natural progression. And we, going forward, I think with the new platform and kind of new initiatives that we're working on, is very much focused to also tie that into PCN resilience going forward. I love this slide. So it's actually not a very professional slide, but I love it because I think it really summarizes all the parts of MLM that I love being involved in, and all that our members kind of get to access from monthly CPD. We've got a partnership with discounts for Headspace, Redwell, Chase de Beer, and lots of mentoring, coaching resources, and well-being, which I love being part of, actually. So I think having any kind of flexible workforce in any area really involves also developing community to support them to work at their best. So I think I might skip this one and then just go, actually, no, why don't I talk about it? Okay, so I think currently, actually, no, let me, oh, well, why not? I'm here now. Why not just do it? So I think current processes and the gap we've been trying to fill is currently practice managers will look for sessions and they'll need cover, and then they might go through Chambers or a platform or something like that to cover those sessions. And I think the gap we've been trying to fill over the last number of years is to really integrate and make that process really seamless. And that, with our digital framework offering, is pretty much where we're at. You can tell I didn't have time to edit my slides. Some of them are duplicating. So if you're an ICS workforce lead and you're tuning in, or you see this, if you're a training hub or you're involved in primary care workforce in your area and you want to find out a bit more about the framework and a bit more about what we're doing, you can go email digitalsupply.framework@nhs.net, and they'll send you the pack, which has a list of the digital solutions on there, including My Locum Manager. And you can then, they've made it quite simple actually to access us. So you can do it by a direct award or by a mini competition. The key thing though is this funding that's available in each area is available until the end of March. So not long time. So if you've not been aware of it, or if say you're one of our GPs or you're a locum GP and you think, do you know what, this sounds like something I really want in my area, then by all means contact your training hub and your workforce lead, give them my name and tell them about My Locum Manager, and tell them, signpost them to the framework, and then they can find out all the details that they want. And Gandhi, I'm going to give you some links, aren't I? So anyone watching this afterwards can tune in and do it that way. Okay, I've talked about that. Oh, actually, one thing I probably should say. So I'm going to do a little demo of MLM as it is now. And I think if you'd like to see where we're kind of our new product, I'd really like you to contact us so I can sit down and go through it with you in detail. But I think kind of where we are now and where we're going, like, I'm hugely excited about it because it's not been done before in primary care. And I feel like just the feedback that I've had from the people contacting us on the framework and everything else is that it's a really exciting time for, I think, people who want to work flexibly through our platform, and for practices and PCNs who want a really unique system to support their workforce. So Gandhi's going to show you the link. So now, Gandhi, you're going to have to talk me through how I'm going to go on to, I go to share screen. So guys, what you don't know is before we logged in live, I was having a little bit of a Google Chrome issue going on.
Well, we got you up and running, so we're here and ready to go. Just whilst you're loading that up, so we have had another question that came in from Hester Dunlop, and she was asking, does each ICS need to decide to use one platform at some point, or can each PCN or provider choose their own kind of platform?
That's a really good question. So actually, they've given, there's local autonomy on how you would like to use the funding and your digital supplier. So, I mean, our system's quite unique because you can add, as a GP, if you've got a number of different providers offering, I don't know, one's offering extended access, another's offering out of hours, and then you've got MLM in for the rest, you can actually add those. But there's local autonomy on how it's used and what is used. And
is that autonomy at the ICS level, or is that going to be at the PCN level then?
You know what? It's so interesting you say that, because it totally depends on the area. Okay. So it's just totally how the funding flow is working has been an eye-opener for me, definitely, because I'm talking to, like, all of a sudden I'll get an email about, oh, you know, we want a demo, and then I do a demo, and it's each time it's somebody different. So it's someone at the ICS, or it's a training hub, or it's somebody else. So each time it's been very different. So I'd say speak to your local primary care workforce leads and your ICS leads and training hubs in your area and find out how they want to proceed with that. Okay, so let's see if I can get this up and running. So what I thought I'd very quickly do is just give you a brief overview of the MLM standalone platform and kind of the way it works, because as Gandhi told me, I'm expected to do this on this talk. So I was like, okay, I wasn't planning on doing it.
Well, we like to show people how it works. There we go. It's just coming up now.
Okay, so this is our practice portal, which people can use to roster all types of workforce, get a view on who's on the ground, and they can see who's, this should come up with me and Matt. Yeah, perfect. Not our actual users. So then you can kind of just see, and if practice managers are using this for their own bank, they can kind of set the dates of their documents, view the documents. If any documents change, everyone gets alerted. But it means there's like there's a way practices can take ownership of the CQC documents, as well as relying on us to do the same. And if they want to send out, I don't know, you know, you want to book in your rota for the next month or 2 months or whatever, you can literally just select a template, set the dates. We've got COVID risk assessment built in. You can select the staff type that you want, select the shift type that you want to allocate, set the rate, add the duty, add any messages like you might want to add, you know, if it's a branch surgery, for example, or rooms or any kind of information, and then that pops up for the GP, which I'll show you. And then you can actually send this out to your chosen GPs, your little bank, your external bank, or in areas where we're kind of providing it across the CCG, that the whole area, if you wish. And then you can manage multiple sites and multiple services. So you can manage your hot sites, cold sites, practice backfill, remote consultations. I'm just trying to think of all the other bits. Basically, you can manage all your practices across a PCN on one system and one dashboard. And as I've said, we've now built on this and created an even more seamless product, which I'm really excited to show you guys when you book on the link. So the other thing I wanted to show you is and also from here, you can also manage all the invoice, payroll, pension, track like the activity that's been happening across your area, the sessions that you've had booked, all the data that you might need to plan your services going forward. And then if I show you, this is when I'm trying to share multiple screens, it's always a little bit tricky. So then what do your GPs and other professionals see when they log on? So essentially what we partnered with a large CCG a couple of years ago, and we did a bit of an experiment, which was, can you, rather than booking by rate in an area, can you just encourage GPs to work flexibly by sharing their time? And we built on that. So essentially, GPs will set the days and times that they want to work, and they'll receive notifications based on that. We tie up all services. So, you know, this is a federation that's running this particular service in the area. You can add all your portfolio roles as well. It's not just about your locum shift. You can add your own practices that you access directly, as well as those that you might access externally. So each practice will send you notifications for the days that you might want to work. So you'll see this is a telephone and video session. You can request the session. You can contact the practice directly. You can locate where the practice is if it's a new practice in your area that sent you requests. And then you can manage all your invoicing, pension, your tax, have a summary of your contributions, the tax you're going to owe, the sessions that you're working, upload your receipts, but basically manage your whole life on one system very easily. And you'll see here, so coaching session, MLM webinar, a lot of our ethos has been around support and kind of helping GPs work their best, access good quality teaching and training. I know you and me are going to talk about sharing a few bits that you've been doing as well. And they can allocate that all in and manage it all seamlessly on their calendar, which links to their phone. And so they get alerts and they know where they're supposed to be. So yeah, I think I'm really excited, and I hope was that the kind of, did I do the right tech demo for you?
Yeah, so I guess the key thing is it shows a platform that allows you to easily and quickly collaborate the availability of your workforce versus the capacity and demands of the system, and can do that from a automated process. That's my understanding of what you've just shown. Is that about right?
I think you're going to be my new salesperson.
Okay, fair enough. But you know,
it really well. Yeah.
That kind of thing is really obviously useful. So many of the GP learners will know I talk a lot about automating your calendar process, having to go back and forth, that whole communication in terms of, oh, I'm free here, but no, I can do it here. Just making that process so much easier saves everybody time. And I guess also the benefit of this is it allows you to share it from across a whole area. It's not just restricted to one practice.
System wide. And I think with kind of with EMIS, like that whole setup brings it to a whole nother level actually, which is really exciting. And I think actually the feedback's been like, this is going to really like revolutionize the way we work and automate everything end to end. So I think that.
So I know that EMIS integration. Can you explain a little bit more deeper what that EMIS integration actually means? So is that specific clinics that people will be able to book into? Just exactly what does that mean? And I know you're looking at other platforms as well, but so
we're expanding it out. So I think that's been a collaborative project from both sides to essentially create a workforce management system using EMIS Web, which is linked to a community, which our site also optimizes with the functionality that we have. So it allows an end-to-end workforce management system directly from EMIS Web.
Cool. And I guess with that, then hopefully there's the view that it's not just GP workforce; it's also other roles.
Oh, it's everybody. Yeah, it's everybody. So I think that also makes life a lot easier. But what I'm going to do, because I promised you this last time, I'm going to drag someone from EMIS on here next time, and we'll do like a proper all singing, all dancing.
Absolutely. So it is interested in having a look at this product. Obviously, Surina is more than happy to demonstrate the full kind of working. Because of tech and stuff, unfortunately, we can't do that for you right now, but we have seen some snapshots, which is awesome. If people did want to contact you, Surina, what's the best way of doing that?
So you can either go on to My Locum Manager and click demo. We've got a demo link kind of going on our homepage, where if you're an ICS or a training hub, you're more than welcome to join, link in there and sign up, and I'm happy to do a demo. Or you can email me, Surina@mylocummanager.com, if you need more information about the framework. And I think you're going to post some notes and
so they'll be down in the show notes. If people are looking on this on YouTube and stuff, just have a look underneath the tabs kind of stuff, and you'll see all the links. I'll put those up as soon as we finish the talk and things. And you'll be able to get in contact from there. And hopefully people will be able to see the kind of elaboration and basically the way that this platform can help your local area. I know there's some timeframes that come with this. I mean, what were those timeframes again? Can you just remind us?
Yeah, so the funding deadline is the 31st of March. So I think what it offers each area is the opportunity to try something like our, solution funded across their area and to see the benefits for themselves. And I think we've kind of been tried and tested now on both sides over the last 6 years. So I think we're kind of really excited on what we can bring. But I think also with the funding, if you don't access it, you lose it. And if you're not using it to digitize some processes across your area, if you're going to, I don't know, maybe use it just for manual processes, then maybe a year's time you'll be back to where you started. So I think it's a really exciting opportunity. I think that probably people are also, swamped with COVID and all these other things. So, but don't miss out. It's definitely an amazing opportunity. And to just kind of, utilize things and systemize things in your area.
And that was Surina@mylocummanager.com. Yeah.
Great.
So
thank
we'll just
you.
stick that up on there for everybody so you can see it on the screen as well. As always, if you do have any further comments or questions, let us know. We're more than happy to try and answer them. I know we've got some other kind of comments, but happy to deal with those shortly. And in terms of everybody else, as always, EGP is here to help save you and your patients time by taking hands in primary care and learning. And we'll catch you in the next episode. Bye.
Bye.